Good morning, students. For your Unit 2 or second grading period, you're going to learn about your healthy lifestyle. But for today's lesson, we're going to take up about modifiable risk factors of lifestyle diseases. First, we have here smoking, number 1. Almost every organ in the body is damaged when a person smokes. It weakens the body and leads to many diseases. It contains hydrogen cyanide, a deadly substance used in gas chambers. Tar is a harmful byproduct of smoking cigarettes. This toxic substance is carcinogenic and accumulates inside the respiratory system. Tar buildup disrupts clearing process of lungs and ruins air sac. Nicotine is a toxic chemical compound that is mostly consists nitrogen, which also makes the cigarette addictive. Nicotine makes the heart beats fast, lightheadedness, and upset stomach. Carbon monoxide is a poisonous chemical from burnt cigarettes that makes the heart do more work to supply sufficient oxygen in the body. And this one, we have kinds of tobacco smoke. Okay, we have kinds of tobacco smoke. First, mainstream smoke. Your mainstream smoke, commonly known as first-hand smoke. It's the smoke from the cigarette that is both inhaled and exhaled. The second is second-hand smoke, a very dangerous smoke when taken in. It is a smoke puffed out by smokers, okay, called environmental tobacco or side stream smoke. Third-hand smoke refers to the cigarette of offshoot, which is attached to the smoker's hair and clothing as various surfaces like walls, floor, furniture, chairs, and toys. This will remain in the environment even if the smoke is already gone. Here is the question: why do people start smoking? Okay, there are different reasons why people are doing this. There are different backgrounds of each people, but then we have to consider the following reasons. It might be or parental modeling, adolescent experimentation, rebellion, maybe weight control, aggressive marketing, stress, depression, limited education, and addiction. Okay, and why do people keep smoking? Why? Okay, maybe they are smoking to use of other substances, nicotine dependence, pleasure and what they're doing, and fear of weight gain. Besides these long-term problems, the chemicals in cigarettes and other products also can affect the body quickly for smokers. First, we have here problem number 1, you're having bad breath. Cigarettes leave smokers with a condition called halitosis or lasting bad breath. Second, bad smelling clothes and hair. The smell of stale smoke tends to last, not just on people's clothing but on their hair, furniture, and cars. It's hard to get the smell of smoke out. Trouble keeping up with sports also. Smokers usually can compete well with non-smokers. Physical effects of smoking like fast heartbeat, decreased circulation, and shortness of breath harm sports performance. Okay, so if you're a sporty person, okay, if you're an athlete, you have to take note that you need to stop smoking and focus more on your sport. Okay, and this one, it gets risk of injury and slower healing time. Smoking hurts the body ability to make collagen, so common sport injuries such as damage to tendons, ligaments will heal slowly, okay, than of those non-smokers. And increased risk of illness. Studies show that smokers get sick more with colds, flu, bronchitis, and pneumonia than non-smokers. And people with some health conditions like asthma get sicker if they smoke, and often if they're just around people who smoke. Teens who smoke as a way to manage their weight often light up instead of eating, so their bodies can lack the nutrients needed to grow, develop, and fight off illness. Next, number 2, your poor dietary habits. Your dietary habits are the usual choices of food that people make. Diet affects the individual's health condition, and having a healthy and balanced diet early reduces the chance of developing diseases like cancer, osteoporosis, and diabetes. Poor dietary habits occurs when the person does not follow the principles of good nutrition. Take note, our principles of good nutrition, we have adequacy, balance, and variety. When we talk about adequacy, it refers to the moderate amount of nutrients to maintain normal body function. But when we talk about balance, it is more on the correct combination of nutrients. Okay, you're balancing your meal. But in variety refers to the consumption of different type of food products. Okay. Your poor dietary habit is about not eating enough healthy food, underconsumption and overconsumption of unhealthy food and drinks, and intake of low fiber, high fat, high salt, and high sugar are all part of poor dietary habits that affect the amount of essential nutrients in the body. Okay. But then, what causes this? What causes poor nutrition to people? Okay, poor eating habits include under or overeating, not having enough of the healthy foods we need each day, or consuming too many types of food and drinks, okay, which we are low in fiber or high in fat and other things. These unhealthy eating habits can affect our nutrient intake, including energy, protein, carbohydrates, essential fatty acids, vitamins and minerals, as well as fiber and fluid. Okay, how does poor nutrition affect us? Poor nutrition can impair our daily health and well-being and reduce our ability to lead an enjoyable and active life. In short term, poor nutrition can contribute to stress, okay, tiredness, our capacity to work, and over time, it can contribute to the risk of developing some illness and other health problems, okay? So we have other health problems that would affect us by our poor nutrition. We can have being overweight or obese, tooth decay, high blood pressure, high cholesterol, high heart disease and stroke, type 2 diabetes, osteoporosis, some cancers, depression, and eating disorders. Okay, that's it. Next, we have your sedentary lifestyle. What is sedentary lifestyle? Sedentary lifestyle, a physical inactivity, is the leading risk factor of death worldwide. According to WHO or World Health Organization, 60 to 80% of the people's population does not have enough physical activity. Sedentary lifestyle occurs when an individual lacks the recommended level of regular physical activity or physical inactivity. There are diseases associated when you are having an unhealthy lifestyle. There are diseases connected with this. Number one, cardiovascular disease, a disease of the heart and the blood vessels, and is leading cause of death in the Philippines. Okay? And under these disease, your cardiovascular disease, you have atherosclerosis, coronary heart disease, heart attack, angina pectoris, rheumatic fever, arrhythmia, congestive heart failure. When we talk about arteriosclerosis, this is a condition causing the arteries to harden and thicken. But when we talk about atherosclerosis, this is a type of arteriosclerosis where deposited fats hardens and become plaque on arterial walls. Okay. Coronary heart disease or coronary arteries, or the pathway of blood to the heart muscles, are narrowed or blocked. Heart attack. Okay. Heart attack, cardiac muscle failure due to lack of blood flow to the heart. Angina pectoris is a chest pain from narrowed coronary arteries due to inadequate oxygen for the heart. Rheumatic fever. The immune system attacks the heart and can cause fever, weakness, and damage to its valves. Arrhythmia, irregular heart rhythm brought about by faulty electrical conduction system that is worsened by uncontrolled stress levels and high caffeine intake. Congestive heart failure. The heart is not able or below its normal capacity to pump blood, causing liquid to accumulate in the lungs and other areas of the body. Okay? That's under cardiovascular diseases. Second, your cancer is a disease where the cells divide in an uncontrolled pace. These cells can form a tumor, which can be identified benign or malignant through a biopsy procedure. Cancer is not contagious or caused by injuries or accidents. One of the risk factors associated with cancer is unhealthy lifestyle. The most common type of cancer in terms of incidence is, of course, breast cancer, lung cancer, prostate cancer, and colon cancer. Okay. Malignant is cancerous. The tumor can spread to invade and destroy nearby tissues and body parts. While benign is not cancerous, benign tumors may increase in size but not invade the body parts. It is typically harmless unless it obstructs normal tissues or organs. Categories of cancer. Carcinoma, the most common, an invasive malignant tumor from epithelial tissue that tends to spread to other body parts. Cancers of the skin, breast, uterus, prostate, lung, stomach, colon, and rectum are examples of carcinoma. Sarcoma, a connective or supportive cancer which include muscle, bone, fat, blood vessels, and cartilage cancers. Lymphoma arises in cells of the lymphatic or the immune system's tissues, characterized by abnormal production of white cells and decreases in resistance. Leukemia, the cancer of the blood or bone marrow, characterized by an abnormal production of blood cells, usually leukocytes or white blood cells. As we proceed to the next, we have number 3, diabetes or diabetes mellitus. Diabetes resulting to a condition of the body wherein the body is not able to produce or effectively use insulin is the hormone that is produced in the pancreas, which regulates the utilization of glucose. The presence of insulin instructs the cell to uptake glucose that is in the blood. Low insulin production can impair glucose uptake, which elevates the glucose level in the blood. 3 types of diabetes. First, we have type 1 diabetes. Type 1 diabetes is insulin-reliant diabetes because the body produces little or no insulin at all. The immune system destroys the cells producing insulin, which causes the buildup of sugar in the blood and loss of sugar in the urine. Its symptoms include increased thirst, frequent urination, continuous hunger, weight loss, blurred vision, and tiredness. Type 2 diabetes is non-insulin dependent. This occurs when the body produces insulin but it cannot be used by the cells. This type of diabetes is manageable through oral medication and lifestyle based on diet and exercise program. Symptoms are usually not very obvious and may go undetected for many years. Okay. Next, gestational diabetes occurs in certain pregnant individuals. The hormones cause the body not to respond to the insulin produced by the body. This is not harmful to the baby and can be treated only with proper diet. Gestational diabetes usually regresses after childbirth but has higher chances of developing into type 2 diabetes. Okay. The fourth one, we have chronic respiratory disease. This is commonly called chronic obstructive pulmonary disease, or COPD. Occurs in the air paths and other parts of the lungs. Symptoms include breathlessness, chronic cough, and excessive mucus production. That's all for today. It's about the modifiable risk factors of lifestyle diseases. Okay, these are all the risk factors when you are keep on doing unhealthy lifestyle and keep on doing things not good for your health or for your body. Okay, so starting today, please make sure that you do things for your own good. You do things to make yourself better, to make your body more healthy, and choose the best option. The way you eat, okay, the way you do your daily activities, choose the best for your body. Okay, that is all for today. Thank you for listening, and I hope you're having a great day. Thank you, and God bless.